Good morning, everyone, and thanks for joining in for today's session. So we're going to be looking at Learning Outcome 5 today. I've just about shared the indicative spec and the learning outcome, which you see on your screen. Today's learning outcome is an interesting one because it will teach us, things about the different types or classification of medication that we use to treat infectious diseases. In general, first, let's look at diseases, and then we'll go into, obviously, details of infectious diseases. So for some of us, it'll be useful because I think if we know that we have taken some medication, when we do fall ill or when we are not feeling well, or for example, as we say in the UK, we are feeling under the weather. So in some cases, when you do go out and see your GP, what tends to happen is that depending on the severity of your infection or the illness that you've contracted, they normally end up recommending you, some sort of medication. Now, there are different types of medication. That is what we are going to be looking at today in this particular learning outcome. But the focus is going to be primarily to understand how and what type of medication is generally used for the purposes of, treating infectious diseases. So feel free to ask me any questions during the course of our session, and then you can ask me through that. You can ask me questions through the chat route, or you can unmute your microphones and ask me a question there and then. So there's only one assessment criteria in today's learning outcome. Tomorrow's session is going to be looking at the assignment discussion. So today we want to finish learning outcome 5, thereby completing this particular unit. And tomorrow the discussion will focus on primarily in terms of looking at the assignment brief for this unit and how do we put together and understand and obviously do the assignment. So today's learning outcome is about understanding how infectious diseases can be controlled medically and how pathogenic drugs resistance can arise. So sometimes we do get to hear that statement that, the doctors and GPs do not prescribe antibiotics very freely in the UK is because once the, let's say, pathogens get immune to the drugs, then obviously there are so many different types of medications that can be applied. And then using antibiotics sometimes in case of viral illnesses does not have any effect because virus illnesses cannot be controlled through antibiotics. So in some cases, doctors restrict from, obviously prescribing antibiotics or, severe doses of antibiotics primarily to ensure that strains of pathogen do not become, immune to the drug and thereby reducing the arsenal or let's put it this way, the medicines or the medication that we have in the medical arsenal to be able to apply in those cases. And then we'll go into a bit of details, but we'll also discuss the assessment criteria, which talks about the use of antibiotics, antiviral, antifungal drugs as a method for treatment against the pathogenic infections. Because we've learned that the pathogens are of different types. They can be virus, they can be bacteria, they can be fungi, they can be protozoans, they can be unicellular or multicellular organisms, they can be macroorganisms, which are organisms that we find on the human skin, and these are all possible candidates for the purposes of transmission of infectious diseases from one human to the other. So in those cases, we will be looking at different types of drugs, and different types of drugs are characterized by different molecular structure and the basics in terms of how these medications are then prescribed and administered to humans in order to control the spread of infectious diseases. So let's look at a presentation, which is what we're going to use for the purposes of discussion for this particular learning outcome. This presentation has a couple of slides, and we'll go into detailing of each of the different types, but let's start across with, when we talk about different types of drugs that we're going to discuss, but let's start off with some basic terminology on understanding medication first. Now, one of the things that I want to look at discussing is, when we look at medication and when we define medication, so what does medication, or say, for example, a general question which should come to your mind is, what is medicine or what is medication that is given generally to people when they are having or showing symptoms of disease? So when we look at medication in general and in terms of define the use of medication and its administration, what we are generally looking at is a chemical compound, essentially, which is going to be used to treat or cure an illness. So that is what is medication. So if I just insert this line here, what is medication? So medication is primarily nothing but a chemical compound, and that chemical compound is going to be used to treat or cure illness. Now, generally, it can be said that, not all medication sometimes is able to treat the illness, but it can reduce the illness or severity of illness. So when we talk about medication, a simple form of medication, I'll give you a practical example is I've had a bit of a sprain in my back muscle. And one of the simple forms of medication that I'm doing is basically applying Voltarol and having a cocodamol or paracetamol tablets when essentially you get pain in your back, especially when you're moving around, getting up and sitting and things like that. Now, this medication is helping me alleviate the pain that you are having because of the muscular cramps or, the spasm that I've had in my back muscle. Now, it will take its own time for it to get cured because muscles, when they get stretched or obviously when they get injured, they will take a bit of time for it to recover. But the medication is going to help me alleviate the pain, or in some cases, help me overcome the pain, wherein thereby it will also soothe and help the muscles to recover. So medication, when we talk about, is a substance or a chemical compound that is primarily used in treating a disease or relieving a pain or curing an illness. That is the definition of medication. Now, medication can be different types. Because we have different types of diseases, medication can also be of different types because each medication has its own typical characteristics, the chemical formulae, or in some cases, we would say the different types of substances which could help in curing or helping to cure a particular type of illness. So when we do talk about medication, we talk about different types of medication because that is where categorization of medication happens. So when we look at medication, which could be categorized on the basis of pain or pain relievers, essentially antibiotics, antacids, these are things that we've had during the course of our time as growing up during the course of our time growing up as children and becoming adults. So when you say, for example, if you're allergic to pollen, and during the summer months when pollen is high in the air, we normally get hay fever, or you have a running nose, or you sneeze quite a lot, then in those cases, what you're looking at is basically some sort of a reaction to the increased pollen in the air, and that essentially is affecting your body, and that is where you are given piritones to basically overcome that particular reaction. So each category of medication is developed specifically to need an aid in a particular illness or curing a particular illness. Now, when we talk about different types of medication, we are looking at antibiotic medication, we are looking at antiviral medications, antifungal, and antiparasitic. Now, they are generally this classification that we talk about, of medication is generally defined in these 4 types. And I think there is a table somewhere in the slide that I put, or if I've not put, then I'll show that to you. And that particular handout or the these table essentially shows you a categorization of the 5 different type of medication that we normally use for the purposes of treating illness. Now, these medications can be categorized on a particular, let's say, use, which is based on the criteria. And sometimes that categorization typically, can be done on the basis of what is called the therapeutic use or effects. It can be chemical composition, and it can be a legal status. So the categorization of medication, what we need to look at, we are not going to go into, how drugs are classified in one of the agencies when we look at in the UK, which is MHRA. I don't know how many of you know about it, but one of the agencies in the UK, which is a government organization called the Medical and Healthcare Products Regulatory Agency, that is a government organization which primarily, let's say, does the classification of medication, approval of new medication when it is coming out, and then whether it's safe for this medication and treatment and doses of this particular medication are safe enough to be administered to the members of public. So it's a very wide topic. And what we are going to look at primarily is going to focus on the types that are going to be related to when we talk about, their application to controlling infectious diseases. So when we look at, the types of classification of medication, we look at antibiotic, antiviral, antifungal, and antiparasitic. Now, these are medications as from the word it describes. Antibiotic is obviously, something which, so when we talk about, say, for example, antibiotic, what is antibiotic? Any idea? We've covered antibodies and antigens. So antibodies or antibiotics are used to treat and prevent some sort of bacterial infection. Now, when we talk about antibiotics, they have been categorized as a term used in medication, which are used to treat and prevent what are called bacterial infections in both human and animals. Now, their function primarily would be looking at, obviously, when you administer this medicine, it will be looking at killing the bacteria, or basically controlling the spread of bacteria or the infection, and thereby inhibiting the growth and multiplication of the bacteria, thereby allowing the body to develop immunity. And that time frame in which the body develops immunity and then it effectively combats the infection allows the time which the body cells, or in this case the leukocytes, white blood cells, require for it to generate antibodies, which will then get rid of the bacterial infection. So when we talk about antibiotic medication, they are generally used as a term to discuss and look at treating what are called bacterial infections. Now, in the olden days, we used penicillin, which was one of the first type of antibiotics which were introduced. Then we look at ciprofloxacin. We also look at tetracycline, amoxicillin. There are different types of molecules and different names for these chemical compounds or formulas, which are then used in different variation. When we talk about, sometimes when you look at medication and you buy something from the market, it says 5 milligram, 2 milligram, 25 milligram, 75 milligram. That is the strength at which the medication actually works. So the chemical compound and the mixture of it primarily depicts, what is the strength of the medication that is being administered sometimes to people. So, for example, adults are normally given antibiotics, but they could start with 250 milligram or even 500 milligrams when you are treating severity in terms of infection. Children are normally given, up to 2.5 mg or 5 milligram mixed with some sort of soluble, compound which is sweet, so that it is not difficult to administer medication to children because of the taste or the taste factor side of things. So what we need to know at this stage is, when we talk about antibiotics in terms of medication are used to treat bacterial infections. Then we talk about antiviral. Antiviral medications are type of antibiotics, which essentially, when we talk about viral infections, there is no antibiotic which works against viral infections. But sometimes you are given antiviral medication, which could be a combination of syrups, capsules, or something which is ingestible, and they would normally be used for the purposes of treating viral infections. One such type of antiviral that we see is cyclovolare, and that is normally used in the treatment of shingles. So shingles is a disease that humans can get, and in the adult stage, I don't know if you recall, a couple of days back, it was in the news that government is now looking at administrating and mandating the use of chickenpox, medication to children at the age of 18 to 24 months. And in some cases, when chickenpox manifests in the adult stage, it is normally termed as what is called shingles. So it is a severe form of, chickenpox, which can happen in adults. And it is normally a disease which is related to or classified as what is called antiviral. So in this case, because of virus, and in this case, it basically requires antiviral medications like cyclovolare or versicyclovolare to be given. And this depends on, the type of drug which is given to treat that particular disease depends on the severity of shingles that the person is getting. And shingles is basically nothing but a viral infection, which basically is, advanced stage of, let's say, a chickenpox disease, which typically is seen in, children. But in the adult stage, it can happen in the form of what is called shingles. Now, there are lots of effects of, sometimes after effects of taking medication as well. And sometimes these effects can be negative effects, which can also affect the human body. So that is why antibiotics or antivirals or any sort of, biotics in treatment of diseases are always given in what is called, moderation, simply because some of these antivirals or antibiotics or antifungals can also have detrimental effect on the body or the development of the human body. So especially in the case of children, some of these drugs are done away with unless there is no other option, or the severity of disease is so much that it requires medication to be given, because it can alter the way the children bodies are growing. And in those cases, that is why restriction on sometimes the administration of these antibiotics is done, and only can be done in the UK when a GP or a doctor prescribes it. We look at antifungals. Antifungals are basically antibiotics which are used and given when you are having a fungal infection. They tend to be like amotericin. Say, for example, when you have an athlete foot, one of the common form of antifungal diseases that we see, which can happen, and in those cases, creams or ointments or creams or solutions, including tablets, which can be prescribed, will be helping in treating antifungal, or will be useful against fungal diseases. Then we look at antiparasitic medication. They are basically medication like chloroquine, which is given when typically people are being treated against malaria. You could also, have, say, for example, different forms of these medication, which can also be primarily given through the use of, gels, or, for example, in some cases, in severe cases, they can also be injected or intravenously given, depending on, again, the severity of the infection. So medications like chloroquine, albendazole, some of them are tongue twisters unless you say them quite often. You have furadazine, you have, piperazine. These are all different forms of medication which are predominantly given when you have parasitic infection in the body. One of the things which we have seen, we have given and we have administered, children often, when they're growing up, they get worms in their body. So, for example, if the children get roundworms or pinworms, piperazine as a medication is primarily given, and a dose of 3 doses is normally given in order for it to be, helpful for children, essentially, to get rid of the worms within the body. So, depending on the severity of infection, sometimes the dosages of medication are also altered and given, primarily to ensure that once you start a particular course, that should help you get rid of that particular disease. So this is something that we need to understand just before we get into more details, that what is medication? It's a chemical compound. It is basically a substance which is used in the treatment of, I would say, diseases, or it helps in the curing of any sort of illness, and that would be termed as medication. And there are different types, and these are the different types that we need to be at least aware of superficially, that they are antibiotics, antivirals, antifungals, and antiparasitic. Any questions on this so far? Okay. Now, the point that I was trying to make is that sometimes we GPs and doctors restrict from over-prescribing antibiotics is because there is increased amount of drug resistance which is being built by pathogens in the last couple of years. So when we look at the trends wherein if antibiotics are given freely, what we can also see over a point in time is that some of these pathogens can develop resistance to the medication. And when development to resistance or when resistance is developed by pathogens against a particular medication, that would mean that it becomes ineffective. Now, these chemical discoveries or chemical compounds are very difficult to make and obviously discover. So penicillin was maybe the only antibiotic which was primarily given when operations were done, when pain was to be alleviated, or codeine. Different forms of this can be termed as different by different names, but essentially the formula remains the same. It may be that the strength of that formula can be named differently, or if different companies and pharmaceutical companies, come out with it, they might have a different name. But penicillin, if you see, was maybe the only chemical compound which was essentially, available in terms of as an antibiotic or used during the treatment of, operations or severe diseases. But over a point in time, most of the pathogens then developed immunity against it, and then new formulas and new medication has to be discovered. So as you can see, this part of the process where the drug resistance develops within pathogens then can lead where the put pressure on scientific community and various let's say organizations which contribute towards the development of new chemical formula and discoveries. It takes a lot of time for it to happen. So penicillin was extensively used, for example, during World War II in the 1920s, when Alexander Fleming's discovered the particular medicine, and its purest form was essentially used to alleviate pain, or when surgeries were done, primarily it was given. But obviously, when it started, there was the use of this particular drug was started over a point in time. What we do see is that most of the pathogens have now developed immunity, and new forms of penicillin or chemical changes with chemical compounds with changes in them have been introduced, and they are now named with different, they are obviously named slightly differently, and they are now effective against certain types of pathogen. So when we see penicillin being introduced in 1928, extensively being used in World War I and II, and then it became available to public use in the 1940s. What we do see is the discovery and development of penicillin actually revolutionized the way medicine was looked at and administered, specifically in the case of, severe infections or injuries. And the use of antibiotics, and obviously, their usage and their let me put it this way, their role in treating some of the diseases became quite apparent, in the late 1940s, and this was then put to use or was incorporated into normal medicine by most governments and organizations across the world. And these developments of in using antibiotics essentially to be able to treat diseases and for public use essentially transformed the way we look at medication or the use of medication across the globe now. So this particular drug itself, penicillin, that you need to be aware of, had a significant impact in terms of how diseases or how public health and diseases were essentially treated when we talk about the introduction of antibiotics for the use of public use in the late 1940s. So when we talk about drug resistance, what we need to be able to look at primarily is understand that drug resistance primarily to antibiotics can happen when we do see they being prescribed or used quite a lot. And in those cases, what we generally want to do is that when we look at antimicrobial resistance which develops against certain types of drugs, can mean that these medication can be rendered ineffective, or higher or severe doses of medication then are needing to be prescribed in order for it to be useful against certain types of diseases. So when we talk about resistance which happens, what does that mean? That resistance here means that when a drug is administered to, say, for example, antibiotic in the case of antibacterial infections, you would see that the response to these medications will start slowing down. That means these medications will stop having an effect against that particular type of bacteria or category of bacteria. And in those cases, when the medication becomes ineffective, or the other way around that we put is the bacteria becomes resistant to the application of this medication when it is applied or given, then in those cases you would generally see that the bacterium, or in this case, the pathogen, has become resistant to that, or has developed resistance to the, medication. Now, one of the things that we get to see very, very clearly in UK hospitals, do you know what is MRSA? Any idea what is MRSA? So MRSA essentially is, if I look at the definition of MRSA, it is, it is a bacteria specifically. It is and the short form of the bacteria is called MRSA. The full form of bacteria is methicillin-resistant Staphylococcus aureus. Now, this is a strain of bacteria which primarily, typically resides harmlessly on our skin. But if it becomes active, it can lead to severe infections when it enters the body. This particular bacteria is present on our skin. So this is primarily, a bacteria which can reside on human skin, but can cause severe infections when it becomes active. So, or when it enters the human body. Now, this bacteria is basically, something which is specifically very contagious and can cause very severe problems when people undergo surgery and when they are trying to recover, because their body immune system is at the lowest. The body immune system is being restarted after the surgery or after the operation, and that is where the chances of MRSA infecting the body and causing, fatalities tends to be very high. Now, this particular bacteria is found to be present in, most UK hospitals. Staphylococcus aureus, as it is called, the biological name, is harmful generally, but when it basically enters the human body, then it can be very, very fatal. Now, there are lots of different types of medication that are used to treat this bacteria, but in general, what we do see is that this bacterial strain is becoming resistant to most form of antibiotics which are given to patient if they get infected by this particular bacteria. Now, the infection rates of this particular bacteria are quite high, and they range from skin infections to more severe systematic infection. It leads to severe organ failure when this bacteria enters your body. And that is where it becomes fatal for people who have had surgery or operations and are trying to recover. Now, the symptoms of this bacteria can actually start from, simple things like skin redness, swelling, your skin becoming warm. And in cases when it becomes severely infected, you start to develop what is called pus, or swollen blisters, which when burst essentially can spread the infection. So it enters the bloodstream and then it causes severe form of infections, especially pneumonia. And when pneumonia happens, you develop breathing difficulties. Water starts getting filled in your lungs because the exchange of oxygen and carbon dioxide does not happen through the alveoli in your lungs, and that is when your lungs start to become waterlogged. And when that happens, obviously you can have, your body is not able to get oxygen. When oxygen doesn't go to the body, severe organ failures and other sorts of fatalities can start to happen. Now, in order to prevent this, what doctors, nurses, healthcare workers, assistants, nurses, they're all, expected to basically, use very different form or severe form of hygiene. For example, hand washing, using some sort of gel, essentially to reduce the spread of MRSA infections, and also ensuring that any linen or any cloth, when they, we use the PPE, personal protective equipment, when nurses enter and see patients within wards, or, when you're administering medicine to patients, you would generally use the PPE, which is, it could be gloves, it could be a face mask, it could be an apron, or it could be, even the use of, different syringes and types of material. Sometimes when it gets in touch and contact with the patient, you normally, dispose of it so that any signs or any, strain of infection can also be done away with, specifically because MRSA is very, very contagious. So when we look at these kind of bacteriums or pathogens, when they start to develop resistance to antibiotics, then in those cases, what tends to happen is that because their resistance makes it difficult for us to be able to treat those diseases, that is why, maintaining good hygiene and ensuring hand washing and careful use of antibiotics helps to reduce the risk of MRSA infections. So we need to look at understanding drug resistance and then look at an example of where we see certain bacteria or viruses which have developed resistance to antibiotics or drugs. And that is where, sometimes when the resistance is developed, these medication become ineffective. Is that okay? Any questions on this so far? Okay, with this, let's go into the main assessment criteria. With this basic understanding, of what is infection, what is antibiotic, type of medication, what is medication, type of medication, categorization of medication, what is drug resistance, and, examples of where bacterium or, any sort of pathogen can develop resistance to drug, making it ineffective, is what we need to understand from a point of view of getting into discussing how infectious diseases can be controlled through medication and how pathogens can actually develop, resistance to a particular type of drug. Now, when we look at different types of medication, we discuss 4 different types: antibiotics, antiviral, antifungal, and antiparasitic. Now, each of these different types of medications are used to treat different types of pathogenic infections which can happen in humans or in animals. Now, one of the most, frequent forms of diseases that generally, or illness, let's put it this way, which people essentially tend to be, flu during the winter months. And in those cases, you generally see certain type of flu jab or a flu vaccine is normally given. So some part, when we look at how can medication be administered, say, for example, how can this be given to patients? So when we talk about different types of medication and how they can be given to, humans in particular, there are various types through which we can actually give medication. Now, I don't know how many of you know this, but let's put up a quick slide to look at a bit of a discussion on this as well. So how can medication be administered? This is a basic question which should come to your mind when we are talking about, say, medication or drugs. Now, when we look at different types of medication and how it can be given, administered means how it can be given. So how do you think we have given medication to our children? So, for example, when we talk about medication that we have given medication through the oral route, right? That means you have given medication through oral administration. Like, sometimes I'm having cold and cough. So you drink, for example, or you basically take a syrup like Covona or any sort of Benadryl or glycodine, and that is normally taken through the oral route. When you have a capsule, you have your vitamins, you have multivitamins or any sort of such, let's say supplements for vitamins or drugs, you normally have it through the oral route. Then you talk about intravenous. What is intravenous? Intravenous administration means medication are directly delivered into the bloodstream. So they are directly injected or delivered to the bloodstream. Where do you see intravenous medication being given? Any idea?
IVs.
Very good. So that is, in short, intravenous medication. And in such cases, say, for example, when patients are unconscious, they are in coma, they're recovering from operation, or in some cases, for example, I would put it this way, like my dad was very low on his iron. So his iron was intravenously given to bring his hemoglobin levels up. So when your hemoglobin levels drop in your body, your oxygen carrying capacity by red blood cells decreases. That means people can be short of oxygen. They can be short of breath, essentially, when we say in layman's term. So in some cases, that is dependent on the capacity of your red blood cells to carry oxygen. And that is monitored through looking at what are called hemoglobin levels. Now, you are normally given iron treatment or intravenous iron transfer primarily to increase the iron in your body. So if it falls below 11, in the case of women, or falls below 13 in the case of men, then it can be dangerous because it basically can lead to heart attack or your heart becoming and muscles becoming weak if they don't get proper oxygen. So in some cases, when we talk about intravenous medication, your iron supplement or iron infusion, as it is called, is done through this. Sometimes when you are, you are undergoing operation, your food supplements because you're unable to eat, you're unconscious, glucose, saline solutions, those kind of things are normally given through intravenous, administration of, I would say drugs or medication. Is that okay? Then we talk about intramuscular. Intramuscular. So intramuscular administration means that you are going to be given medication through, which is
Injection.
through your muscle. That's correct. So we are going to get medication which is going to be induced into your muscle. And this is normally done when we use what are called, normally used when we use and give vaccines or injections, excuse me. So when we look at giving injections, like most of us have recently had COVID injections or maybe a booster dose of COVID infection or flu jabs, they are normally given in your muscles, and that is intramuscular administration. So this is normally done by the use of vaccines, and in certain cases, certain medication can be given. For example, when somebody has had a sudden seizure of heart, or you're having a heart attack, normally what they do is they straight away take an injection and inject something in your muscles to be able to bring your heart rate down. So sometimes you are also seeing that people are given some sort of a spray. If they are feeling angina or some sort of pain in the heart, they are giving that spray which they normally use orally. But if the pain is very severe and the medics have to transfer you to a hospital, they would give you straight away some sort of medication which will be injected through your muscles in your thigh or in your back or your hips or your hand to straight away alleviate, or reduce the way in which your heart is acting to relieve the pain, so that further treatment can be done at the hospital. Then you also see subcutaneous administration. So subcutaneous administration of drug normally tends to be when it is injected beneath your skin's surface into the fatty tissue. Now, people who have diabetes, sometimes they are given what are called insulin. And when they are given insulin, the insulin is directly injected, into the fatty layer. So it could be given in your stomach, it will be given in your arm, in your near your neck, in your shoulder muscles, and that is normally given through what is called subcutaneous administration. And this method allows for a gradual release of drug and the dose, like insulin, and in some other cases, a medication. And that would mean that we want the medication to flow into the bloodstream or go into the body at a gradual rate, not immediately. So when we are giving intravenous, we want immediate effect to happen because it is being directly injected into the bloodstream. Then we talk about inhalation.
Excuse me, please.
Go ahead.
Like when a woman delivers, there's this injection they give through the stomach for blood clots. So can you classify that as a subcutaneous administration?
I am not sure about that, but I can look into it and come back to you.
Okay.
Now, in some cases, we also look at, inhalation. So inhalation means when you are given drugs, but what you're doing is you're using the oral or the nasal route. Inhalation is when you're using the nasal route, but using, we might get confused it with oral. That means, you open your mouth, but what you do is you press the inhaler or the spray, but finally it goes through the nasal route directly into your lungs. So when we look at inhalation, sometimes when we look at people who suffer with, asthma, are having inhalers, or people who generally sometimes, will need immediate medication, but that will be taken through the nasal route, then in those cases, we will look at the medication being provided directly to the lungs, and this would then flow through the respiratory system of the human body, and that kind of medication would essentially be used to reduce heaviness in terms of breathing within the human body, thereby, administrating through the route followed by the respiratory system will be termed as inhalation. So when you sometimes look at, COVID-19, when we looked at people were falling short of oxygen, and they were put on oxygenators. And the reason why that was done is because the lungs were getting waterlogged because of pneumonia developing, and the oxygenator, when the breathing apparatus is put, that allows your lungs or your respiratory systems to exchange or get oxygen. And in those cases, we generally see, inhalation being used as a route for giving medication. Now, there are other routes as well. One such other route, which we have all seen as parents. Anybody can recall topical administration? What is when you're given medication through the topical route? Topical means when it is applied directly to the skin. So as parents, those of us who are parents have used topical or given medication through topical route, because when we look at babies and they look at nappy rashes, or you look at, when they develop sore skin, sometimes you are given antifungal and, various different types of creams by the corticosteroids, or, essentially creams which are drug-based, and they are generally given and applied on the skin. They could be creams, ointments, or patches. For example, I'm having a back pain, so I bought a deep patch, which is a deep heat patch, which I put up on my backside, and that releases straight away a medication to that affected area only, thereby alleviating the pain that I'm having in the back. So when we look at topical administration, what we mean by that is applied directly to the skins. There could be different types of creams, ointments, patches which could be applied, and they are normally applied to the skin, and medication enters through the skin, that is the mucous membrane of the skin, and it slowly dissipates into the body, and that would be termed as topical administration. Is that okay? Now, there are other forms of administration as well. So one such form which we'll take, just as a case in point here, there would be what is called rectal administration. That means sometimes when we have genital infections, we are also given topical creams or medication which are generally, to treat infections within the urinary tract or urinary system. And they could be enemas, blisters, any sort of, say, for example, rashes which normally develop in the skin, but then they have the propensity to basically infect internal organs. So in some cases, urinary tract, which is an opening in the body through which you excrete everything, can also get infected. So in some cases, some form of creams, ointments, or generally medications are also then applied in the human rectum or anus area of the rectum, that is to prevent diseases to further infect or further inflame the skin, because in some areas of the human body the skin is very sensitive, and that is where also we see rectal administration of medication being done. So typical creams or topical creams which are administered can also be administered using the rectal route, and that is where you would generally see they being used to they are used in conjunction with oral and intravenous administration of drugs. So these are the different routes through which we can look at how medication can be administered in the human body. Is that okay?
Yeah.
Now, when we look at understanding why are we at risk to bacterial infections, so the reason is that over the last 75 years, we have seen the same strains of bacteria essentially, infecting different humans and animals. And because we have been using this similar type of medication or drugs, chemical formula, to be able to treat these infections, over a point in time, what has happened is that these pathogens are becoming resistant to, certain types of drugs. And that is where chemical formulas and medication are continuously altered after years and years of research. Because one other thing which I'll put it here, just as a point of interest, medication is not something which can be introduced immediately. or instantly for the use of people, across the globe. It has to be very thoroughly tested. So when we talk about tests and, introduction of new drugs, it goes through very stringent tests on mammals, mice, then, obviously the closest ancestor that we have is chimpanzees or monkey, apes. And once then it passes those tests of mammals, then it is finally tested on humans in a controlled population to be able to see whether there are any after effects of that medication. Does it lead to any sort of, ill effects? And some of these effects cannot be discovered instantly after having the medication. These manifestations of the reactions can happen even in weeks, months, and even over years. So, introduction of new medication in the UK is done by an agency called MHRA. They are the ones which approve all medication. They will review it. They will basically ensure that any such decision to introduce a medication within the market is done by ensuring that it is done in a way wherein it is thoroughly tested. It does not cause any side effects or ill effects, and it is entirely safe to basically then release this medication for the use of public or by medical agencies in the UK to be able to prescribe to public. Now, this agency basically, which is a government body, looks at, three major areas. One, it looks at the regulatory scope. That means it basically looks at regulating a wide range of healthcare products, medication, medical devices, and components or equipment which are used to treat human diseases. The second thing which it does, so if I look at just very briefly, one is regulatory purpose. Second would be statutory. So, for example, in terms of statutory, it would work with other different bodies, which could be government bodies, semi-government bodies, private organizations. It will review proposals. It will look at making decisions and look at making provisional decisions in terms of approving any new treatment or any new type of equipment which could be used for treating, any sort of, say, diseases amongst humans or transmission of diseases amongst humans. Then it will also look at operating what is called certain schemes. One such example of schemes is the yellow card scheme. Now, this particular agency will operate the yellow card scheme primarily to allow individuals to report any suspected side effect or adverse effect of any drug or reactions that are caused by uses of medication or medication given to them for the purposes of treating any illness. And this is going to be treated as what is called a yellow card scheme, because this incident would involve a wide variety of agencies, devices, equipments, medication, and it would then go into reviewing and conducting a thorough investigation to control its spread amongst the population. So when we talk about the role of MHRA and what it does, what they are going to be responsible for is regulating medicine, medical devices, and blood components for transfusion or equipment which is used for the purposes of treatment in the UK. And it's an executive agency which is under the Department of Health and Social Care. And this agency has to approve each and every drug before it is given or cleared for any public use in the market. Now, when we look at the COVID vaccine, Pfizer, Moderna vaccine, AstraZeneca, Johnson & Johnson, lots of companies have now got their own vaccine against COVID-19. But when it looked at approving, it puts these vaccines under severe kind of tests. That means it is done, it takes and does its own testing specifically to ensure that these drugs are safe for use on the human population. So Pfizer Moderna vaccine was tested across 30,000 individuals, to ensure that there are no side effects, and across various types of age groups to ensure that the medication and the vaccine was entirely safe and useful, entirely safe, and then was cleared for use as a vaccine against the to bring this virus under control. So when medication is approved, when it is released, when it is used, the agency provides, a sign of approval or a seal of approval to say that it has carried out statutory, non-statutory reviews and looked at the prognosis, made some decisions, and these decisions are then, favorable and do not cover or uncover any side effects. And then they clear this particular, any particular chemical formula or compound for the purposes of use for the members of public. Now, let's look at, with this background, go into some more detailing of how we see antibiotics can prevent, say, for example, infections. Because that is the crux that we want to, look at discussing. So when we talk about antibiotics and the way they prevent infection is, they are going to basically, cause some sort of a reaction in the body. And this particular reaction, that sometimes when we look at treating the infection and when we look at, when we look at the treatment which the antibiotics provide, what they tend to do is they cause some sort of a reaction in the body which prevents the disease to spread further. That means they prevent or make the pathogen inactive, and making the pathogen inactive effectively renders it ineffective to be able to further spread infection. So when we talk about prevention and when we talk about the action, we use a term called prophylaxis. Now, prophylaxis is basically a treatment which is given by the use of antibiotics. So this is a technical or a biological term that you need to understand, medical term that you need to understand. What is prophylaxis? Prophylaxis is essentially a treatment which is given or an action which is taken to prevent disease by the use of antibiotics. Now, in situations where antibiotics can be given is when you are having an operation, you've had a bite, or you have a wound which is now getting infected. Say, for example, sometimes children get dog bites, or, we get wounds which, for example, when you get your skin gets exposed and they are severe wounds. So if they are not treated or if they are not dressed properly, if they are dressed properly, and then also it takes a bit of time for these wounds to get healed. So in those cases, to prevent infection in the body, antibiotics are normally administered. When you undergo a surgery, or in some cases when you are recovering from a surgery, then the risks of infection are high because your immune system is restarting, and in those cases you are given antibiotics. Now, when we talk about prescribed antibiotics or antibiotics which are generally given, they are going to be different examples that we can give them and under what conditions we can give them. So when we talk about, the use of measures, if I talk about which are designed to preserve the health and prevent the spread of disease. So if I talk about the word prophylaxis now, and we talk about what and how would the treatment prevent the, let's say, spread of disease using antibody, then in those antibiotics, in those cases, what we are looking at is, we are looking at putting different types of prophylaxis or techniques using different types of prophylaxis into place. Now, they could be termed as primary, secondary, and tertiary. But when we talk about primary, what we mean by that is we are trying to prevent or take measures that are going to avoid initial occurrence of disease. Sometimes you nip it at the source, you try and prevent it at the source, and that would be primary, treatment given, which is primary prophylaxis, which is using antibiotics to prevent the spread of disease at the initial stages itself. So in some cases, to do so, we might use, the administration of medication through the intravenous route or intramuscular route, which is basically giving vaccines. And that is what was done in the case of, say, COVID, because you want to stop the spread of the virus at the first stage itself. That means if a person has got infected, you would not give him medication which will be through the oral route or nasal route or any other form of, topical route, because you want to spread and treat the infection, stop the spread of the infection immediately. And that is where intramuscular or intravenous route of medication, which is vaccine, was used. When we look at secondary prophylaxis, this focuses on early detection and intervention to prevent progression of a disease, that has already begun. So when we talk about the spread of COVID-19 disease, which was happening quite rapidly and it changed from epidemic to pandemic, that is where because there was no vaccine and only control measures could have been introduced. That is why lockdowns and other social distancing, wearing a face mask was introduced. But when the vaccine was finally, let's say ready and was allowed to be deployed, then in those cases, the government straight away authorized the use of vaccine as a first measure to control the spread of the disease, or in this case, the virus, and that is where primary prophylaxis or as a as measure was used. Secondary is obviously because we don't know where the virus is coming from and how it is spreading, and in some cases it was a new virus. There was no medication or vaccination available, so that is where the government proposed secondary measures. That is the use of word secondary, and that was use of protective equipment, PPE in care homes, hospitals, use of social distancing, wearing of face mask, making sure that you wash your hands, and contamination could be controlled. Those were the things which were put into place. And then when we look at tertiary prophylaxis, what we were essentially looking at was concentrating on the consequences which the existing disease was showing, but also we were trying to prevent it from leading to complications. So that is where, when we found out in the first impact that people suffer from pneumonia leads to multiple organ failures, and that leads to fatality. So what the government started to do was provision for creation of different large hospitals, makeshift hospitals, which were done in London, Birmingham, and Manchester, because there were high amounts of hospitalization happening. So there was a response which was put in place as a tertiary initiative to ensure that if the infections rise and people get infected, then we need to have enough facilities to be able to, take in people and administer them. The, oxygenators were, for example, the export of oxygenators was banned by the government for a certain point in time, because they felt that in the UK we would need up to 50,000 or up to 100,000 oxygenators, which will be required to treat patients, because they start first symptoms of COVID and COVID-19 infection that people start complaining of breathlessness. They are short of breath. They become short of breath quite quickly, and then that is where the oxygenator or these type of equipment was important, and that is where it was trying to prevent the complication of this disease under the tertiary response. And that is where this kind of prophylaxis, or the term essentially action, is being required or is being taken to look at treatment, which is then designed not just to prevent, but also to look at preventing the disease from spreading quickly, and provide leading to complications are put into place when we are trying to fight something which is an infectious disease and can spread quite quickly. So when we talk about, in general, the use of antibiotics against that, we can categorize that into three different types of treatments which can be done: primary, secondary, and tertiary. And they would then be put into place depending on where and how the infection is spreading, how quickly it is spreading, and how important it is to prevent the disease from occurring or spreading. And in those cases, what generally tends to happen is that the antibiotics which are given, they would follow this particular form of prophylactic treatment, and that would be categorized into three different types. Now, when we look at this administration and let's look at some of the examples. COVID is an easy example because we've just recently gone through the pandemic, but let's look at broadly looking at some other examples of where we see this prophylactic action or use of antibiotics being done when we see and we want to stop the spread of infection. So when you look at people undergoing severe surgery, say, for example, an eye surgery, joint replacement surgery, breast implant surgery, pacemaker, which is fitting of an equipment which monitors and boosts your heartbeat artificially within your heart, and the pacemaker is installed. You look at severe form of surgeries which are requiring replacement of body parts or organs, or removal of body parts or organs. And in those cases, these kind of measures would be put to prevent the spread of infection, or the infection being fatal to the, let's say, the person who's receiving the treatment. Then we look at sometimes a term called underlying medical conditions. Have we seen and heard the use of this term, when sometimes it is heard in news that people who perished or people who lost their lives or were had to face fatalities had underlying conditions, underlying medical conditions? What does this mean? Any idea? What is the meaning of the term underlying medical conditions? So underlying medical conditions tend to be used as a term when we basically refer to people who have a existing or pre-existing health condition. That means they already have some sort of a vulnerable or a chronic disease. For example, people with a severe form of diabetes, type 2 diabetes. Sometimes people with cardiovascular diseases, for example, people who have had strokes or angina or previous heart attacks, they tend to be termed as people who are risk to, they are at high risk to any form of infection which can be spread. And they would generally be used, the term that would be generally used to deal with patients which have already got some sort of a chronic illness or some sort of a previous illness or health medical history or background, wherein they are seen to be vulnerable, more vulnerable than a normal adult or a normal human being. Then in those cases, we would generally use the term medical conditions. So people who are particularly more vulnerable to infections, in this case would be termed as people who have what are called underlying conditions. So for example, people with diabetes, heart diseases, autoimmune disorders, people who are having some sort of, say, for example, even obesity, people who are overweight, have a high BMI than the normal, which is, the case when we look at your body metabolism index. In some cases, people with high obesity can also see more fatalities. And that was maybe the case when we look at COVID-19 deaths. People with underlying medical conditions, people with obesity had severe problems, and their recovery time cycles in terms of recovering from the infection were longer as compared to people which were healthy individuals. We look at neurological disorders, things like epilepsy, Parkinson's disease, people with such kind of disorders wherein your body is already vulnerable or your immune system does not work, completely. Then in those cases, people, having already what is called a vulnerability or some sort of chronic disease or illness would be termed as, people with medical conditions. Now, people with sickle cell anemia, people who have had cancer or have undergone chemotherapy, wherein their immune system is already, showing signs of deficiency, then in those cases, sometimes when antibiotics are given, then these antibiotics are administered or given in a very controlled fashion to be able to have an effect which is required for them to be able to recover. So in some cases, people, when they are given antibiotics, they are given in high moderation or under, supervision, because they have what are called underlying medical conditions, which could make or which could produce reactions which could be fatal, or not useful, in some cases not normal for these patients. Now, when we go into different types of antibiotics, what we need to do now is go into different types of antibiotics. So antibiotics is a specific drug which is used against bacterial infections. Now, when we talk about antibiotics, there are 6 different types or categories of antibiotics. They will be classified as penicillins. That is the main chemical compound. It could be termed as amoxicillin, coamixolov, fluxoxilin, phenylmethylpenicillin, but they are different variations of the same compound. Then you have cephalosporins, then you have aminoglycosides, you have tetracyclines, you have macrolides, and you have fluoroquinolones. These are 6 different types of antibiotics which are categorized or used against what are called parasitic, specifically bacterial infections. Okay. Then we look at antifungal medication. These antifungal medications tend to be given to children or adults, in case when we are having fungal infections or diseases which are basically going to spread through fungi, and they are normally given into the bloodstream directly, and they can travel throughout the body. So for example, when we talk about fungi, they will multiply through creating what are called spores. And when we look at pollen, and when we look at these kind of allergies that we get sometimes during the summer months, they would essentially be let's say parasites which we are going to inhale into the body, and then they are going to go into the bloodstream. So in those cases, we will look at antifungal medication. And when we talk about antifungal medication, sometimes when you look at these antifungal medication, there could be serious repercussions of antifungal medication, because we need to look at tolerance of the human body as well. So most antifungal medications tend to be given in the form of cream, tablets, ear drops, or usage like shampoos and things, because we want them to be used externally. So when we use some of these, we generally see them being used in these kind of infections, essentially when we talk about antifungal. So for example, ringworm in the skin, your hair, your nails, athlete foot, you look at jock itch, and we look at thrush, or a yeast infection. Then in those cases, they would be termed as parasites which are basically fungal parasites which are causing these infections in your body. And there are two widely types of drugs which are predominantly prescribed for meeting what are called antifungal infections, or basically called antifungals. So they are amphoterins and azoles. And azoles, the two different types that we have taken, I'm pretty sure that some of us have taken during our childhood days, are fluconazole and itraconazole. These two medications essentially are given primarily when we get what are called serious type of fungal infections. And they could be athlete foot, something like which is not improving, rashes on your skin which are not going away, and it is further spreading infection in your skin. And some of these are typically when we do get infections which can have an intensity to spread, specifically the yeast infection, which is called candidiasis. Now, candidiasis, yeast infection, where do you see yeast essentially? Where do we use yeast? For those of us who do a bit of cooking would understand, where do we use yeast? Any idea?
We use yeast like in flowers.
We use it to make bread.
For baking
Absolutely.
flowers, yeah.
Correct. You use it for when we use for cake baking, bread baking, or when we want the flour or the dough to essentially rise. When you make a pizza dough at home, we use yeast. When we make bread at home in the bread maker, sometimes you would see that we use yeast. Now, yeast is a very common form of fungi that we use even for eating, and there are different mushrooms which are basically fungi that we eat every day. But there are certain types of fungi or yeast infection which are very, very contagious. One such form of infection is called the thrush, or in the biological term is called candidiasis. So when we talk about candida, that is the yeast essentially which causes this function or infection essentially. So candidiasis, the medical term, is a fungal infection which is caused by yeast, and that yeast is called candida. That is why the term candidiasis. Now, this can cause this yeast can live on your skin and even inside the body, inside your mouth, your throat, your gut, which is in our body. We have different types of bacteria, and some of them are what are called healthy bacteria. So we do get to eat different types of yogurts and other bits which have different probiotic cultures in it, which are useful bacteria which help in your digestion in your body and things like that. But this form of this yeast in particular, candida, can actually be found within the human body as well. And if it basically spreads, then it can cause a very severe type of infection which can lead to say for example rashes, or it can lead to some sort of I don't know the chemical word for, thrush. So thrush, is, let's put it this way, it causes some sort of, so what is thrush? Thrush, the best way I would explain thrush is when you have itching feeling in your rectals or your genitals, when you continuously itch your genitals because there is accumulation of this type of yeast, which is candida, and that is living on the skin or your surface. And when you have rashes, itches, and you scratch and you basically, get that feeling of itching, that is what is basically called thrush. I think that's the closest I can describe. And it can happen in adult when obviously hygiene is not kept, or proper hygiene is not kept. And that is where this particular yeast can cause this particular infection, which leads to starting with itching. Then at some stage, it can cause rashes. And these rashes can develop what are called, a medical term called pessary or pus. And that essentially can be then contagious because it can start spreading and it can cause rashes in your body. So this soft thrush or rash, which actually starts off, can be initially treated with a cream or an ointment, but over a point in time, if it starts spreading within the body, then medications like fluconazole or itraconazole are normally given because we want to spread the infection or the fungi called candida. So this is generally present either in children, because when we are out and about, we are playing about, we don't take care of hygiene, we put everything into our mouth. And in those cases, this is generally seen in children or in adults when hygiene becomes, or when proper hygiene is not kept. So we have different types of antifungal medication, two types that you need to be aware of. One type or category is called amphotericin, and the other is called azoles. And azoles are of different types depending on, which yeast or which particular yeast strain that we are dealing with. Then we have called antivirals. Antivirals essentially are, viruses which cause the infection. And one such form that we get to see, cough and cold, and we all, have that cycle wherein it goes through, or flu that we have is a cycle that we go through 6, 7, 8 days when we have a problem with breathing, our nose, running nose, and, we cough, and we sometimes also, spit out sputum or phlegm, as we call it. But in such cases, this particular type of pathogen which infects us and causes this discomfort is a virus. And in some cases, you would have, obviously, we do not prescribe antibiotics, but in those cases, we prescribe what are called, because they are caused by viruses. So in these cases, the medication given is antivirals. Now, when we talk about viruses which can cause serious illness, AIDS or sexually transmitted diseases that we talk about, different types, are basically caused by viruses. So I don't know how many of you know the full form of AIDS. AIDS is acquired immunodeficiency syndrome. Now, there is no definite medication to treat this particular disease, and in most cases, it can only be controlled. But generally, if a person gets affected, and this happens through having a sexual contact, then in those cases, the medication given primarily will be to, help, let's say, control the after effects of the disease or the virus it causes in the human body. But to the best of my knowledge, I don't think there is any medication which gets rid of the AIDS altogether, although there is lots of research being done by different organizations and, different charities across the world. But this is, a big killer of humans, essentially, because this is a diseased, which primarily has become quite fatal in terms of numbers. And when we talk about ranking of diseases, this particular disease infects about 37.5 or 39 million people, as per the count in 2022. 39 million people are affected, with this disease. Children can also, can also acquire this disease at the time of birth from the mother, if the mother has, this disease. So in this case, there is no known, let's say, drug for it to be able to cure it fully, but there are drugs which are administered which kind of cause or let's say not say cause, but reduce the severity of infection or the ill effects that this particular disease can cause, and that can be used and administered to basically allow the individual to survive for a longer period of time and continue doing normal operations. But there is no absolute cure for it so far. And when we talk about different types of antiviral drugs, there are various different types. And when we talk about these types of drugs, we normally look at Tamiflu, which is one particular category of drugs that we look at, which are termed as antiviral drugs. And we also talk about Paxlovid and remdesivir. These two particular molecules, if I write it down, remdesivir and Tamiflu. These are the type of Tamiflu. These are the type of two major type of drugs that we have seen. And remdesivir was used in some moderation during the control of COVID virus. Initially, it was given to the patients initially who had contracted COVID, and it was found to be useful. Tamiflu is another type of antiviral drug which is given sometimes, to control the spread of viral infection within the human body. So these drugs are crucial as a tool to help in limiting the spread of the virus and managing the viral diseases which it causes in human beings. But sometimes they can be only used to help alleviate the symptoms rather than totally cure the human body of the viral infection. So they can be used for limiting the spread. They can be used to alleviate symptoms that it causes, severe symptoms it causes. And in some cases, it can be used as inhibitors. That means agents to stop or, essentially, let's say, decrease the spread of the, the viral disease amongst humans. So when we talk about, say, for example, Tamiflu and, different variants of these drugs, they can be used to basically stop the spread of, say, flu, essentially, which happens in senior age citizen people during the winter months in the UK or in other developed countries. Your body mechanism is not able to, body's immune system is not able to cope with the severity of virus which infects. So in order to help your body develop immunity against that virus, in vaccines like the flu jab vaccine, or in some cases drugs like the Tamiflu and variants of Tamiflu are given to help in the control of the spread of viral infection. So they could be four different types. You have the acyclovir, you have the amantadines, you have riboflavins and interferons, and these are other type of antiviral drugs which are normally given to deal with what are called viral infections. Now, one of the viral infections which affects humans and generally children quite often is what we know is chickenpox. And I don't know, everybody probably at some age during their childhood days has had chickenpox, herpes virus, and these are influenza, which is the other form of, disease which travels from cows in particular, or people having meat in particular, which has been contaminated or has not been properly cured with the wash of chlorine to kill any parasites within the meat, can lead to infections jumping from animals to humans, and that would be normally influenza. And then we know about the flu virus. So these are normal viral infections or type of viral diseases that we have heard and seen, which are used, which are termed and categorized as viral infections, and to counter them and to control them and to spread the infection of them, we use different types of antiviral, drugs. The last type that we want to look at is anti-parasitic medicines. Now, parasites can generally be seen, which are basically going to be present in the body or can be seen with the, naked eye. So when you look at parasite and parasitic infections which can happen, they normally happen when we either consume food which is infected, we touch or get in contact with, say, for example, in open spaces, we get in contact with surfaces which have contamination. And in some cases, some of these are present, on the surface or the soil, and they can then be transmitted from one person to the other by contact or by, oral or, say, for example, through food and water, when we are drinking food and water, contaminated food and water. So sometimes it is recommended that if you are out and about and you're camping, you should not be looking at, drinking water from the rivers, because the river water might be contaminated with different types of parasites, specifically E. coli, or, any other types which can start causing diarrhea or, severe loss of, water from the body. You could also look at some of these parasites when we go into, say, for example, if you live in a tropical climate, you go for safaris and things, you go into a forest, you would see parasites sticking to your skin, which I gave an example of, like leech, which are blood-sucking parasites, or mosquito bites, which can happen, and they would essentially be termed as parasites, which will cause infection in humans. Now, when we look at these kind of infections, one of the most common types that we get to see is worms within our body. So some of these worms, pinworms, roundworms, ringworms, different types, hookworms can actually, be seen in our body, and they are in some cases termed as parasites, because you would generally see that, these worms can be seen with the naked eye. Now, when we talk about these kind of diseases, they are normally, possible in terms of infections to humans when we either consume food, water, or get in touch with areas or surfaces of soil which are known to be contaminated. And when these parasites find what are called good conditions, they start to grow, and that is where they will start to cause the infection. Now, when we use the word and when we use parasitic infections as known to us as parents, they would be typical worms. And one term which we look at, trichinosis. Trichinosis is foodborne diseases which can be caused by a type of parasite called trichinella. And this trichinella parasite essentially, can be injected into the human body when we eat raw meat, or meat which has not been processed properly, like undercooked meat or undercooked, meat which is infected with some sort of already existing parasites. Now, when we look at cure against these kind of, anti-parasite medication, what we are looking at primarily in this case is, so we can use the term like anti-parasitic medication or anti-parasitic meds, as we call it in short. So anti-parasitic medication or drugs tend to be drugs which are used to cause or basically used against treatment which is caused by parasites, things like protozoans, ectoparasites, worms in particular, or helminths. Now, there are different types of parasites which can infect humans, and then depending on the different types of parasite which can infect humans, then in those cases, in order to see which parasite and which drug is going to be resistant to treating that particular parasite and that infection in the human body, we would use different types of anti-parasitic drugs or medication. And they tend to be of, types like albendazole. We look at, say, for example, ivermectin. We look at other forms of, say, for example, strong forms of antiparasites, which are used primarily for the treatment of such infections, would be, say, for example, like some drugs which are basically based on what are called glycoproteins. And these drugs are going to be, drugs which will destroy the parasites by disintegrating them in the body's metabolism. They will directly kill these parasites. So when we talk about these category of, anti-parasitic drugs, I put it this way, for example, so we look at albendazole. So this is one type of drug. The other type of drug that we call is ivermectin. And we also call, so these drugs, you will have to look at just refreshing. When we talked about macrophages, those are type of cells which basically engulf the bacteria or the parasite and then dissolve the parasite. That means they do away by destroying the metabolism of the parasite. So those type of drugs which are basically going to destroy the main protein of the parasite itself would be the drugs that we will look at primarily when we talk about drugs. So here, when we talk about anti-parasitic drugs, malaria, for example, when we talk about chloroquine, so these are types of drugs which essentially are used primarily to get rid of what are called chloroquine, Quine. So chloroquine tablets. So these are kind of drugs which are basically anti-parasitic drugs, and they are used to treat what are called anti-parasitic infections, depending on, because some of these drugs will go in and destroy the metabolism of the parasite, thereby consuming the parasite and then excreting that out of the human body. So when we talk about anti-parasitic medication, these are different types of anti-parasitic drugs which will target specific parasites, and they would essentially be useful in bringing these parasitic infections under control by either interfering with their reproductive ability or by metabolizing them and then directly killing them and excreting them out of the human body. Selection of the medication. So in a nutshell, what have we learned today? Let me put it this way. Selection of medication that you look at to treat a particular type of infection would depend on the type of pathogen infecting the human body. If it's a virus, what will you be using? If it's a parasite, what kind of medication would you be using? And if it's a bacteria, what kind of medication will you be using? So we look at, if it's a virus, what medication will you use? Yeah, anybody? So we will use antivirals. If it's a bacterial infection, then we will use
antibiotics.
Antibiotics, very good. If it is a fungal infection, then we use antifungal. And if it's a parasite, then it will be anti-parasitic medication that we will use. So in order to understand this particular learning outcome, what we were focused on is understanding how antibiotics work, what are the different types of medication, what is the categorization of the medication, and then what type of medication is typically used to deal with a particular type of pathogen that affects the human body and causes infection. So whether it's viral, whether it's bacterial, whether it's fungi, whether it's parasite, depending on that, we will use appropriate medication to be able to then treat what is called these infections in the human body. Is that okay? So that brings us to the end of this particular discussion in terms of our session. And I would suggest that my bit would be to look at when we talk about, categorization of different types of medication. I think, let me have a quick look on Moodle. There should be a table or a chart that I would normally have. And when we look at the categorization of medication, you would be able to basically go through this particular learning outcome by understanding the basics about different types of drugs and how they can be classified and used to used to treat different types of infections in the human body. Is that okay? So that's the bit that we need to understand in this particular, learning outcome today. And what we have been able to do is successfully look at understanding the different types of drugs, different types of medication, different types of against which they are useful in different types of infection, and they then can be, used for the purposes of treatment of such infectious diseases which infect or can infect humans. So that's it for today in terms of today's session. And what I would suggest is we'll meet up tomorrow to discuss and go through the assignment tasks in detail, for this particular, unit, which is infectious diseases. Any questions, anybody? Any last questions or any comments, anybody at this stage? Okay, that's great. No worries. So, bit of